Welcome to Dementia Friendly Prince George's County, Maryland Northern Sector webinar series for caregivers. Today's topic is Staging Cognitive Decline by Dr. Miriam Galindo, sponsored by Prince George's County Government and Department of Family Services.
Well, it's so wonderful to spend this evening with you. I wanted to add one more qualification about myself. In addition to being a psychologist and a registered nurse, I'm also the former caregiver of a loved one with Alzheimer's, the Alzheimer's type of dementia, that is. And that was my dad. My dad had a long journey with dementia until 2016, when he died of complications due to end-stage Alzheimer's. It was an absolute joy to care for him and a privilege and an honor. But there were some moments, as you all know, that are stressful. And so one of the reasons that I put this presentation together is so that all of you who are trying so hard to anticipate each stage of dementia can know what is required of you as caregivers. And in doing so, then you can feel better prepared. So that's what we're going to talk about today, caregiving at each stage of the dementia process. What we're going to accomplish today is the following. We're going to define what is dementia. What is the general progression of dementia, of the Alzheimer's type in particular? And then we want to address, why do these changes occur? What can we as caregivers do to meet those needs? So those are the four main topics we're going to talk about today. Let's start with defining dementia. Dementia, as most of you probably already know, is an umbrella term. It is the overarching term to describe various subcategories of dementia, like dementia of the Alzheimer's type, dementia of the that's due to vascular disease, or due to Parkinson's or frontal temporal lobe dementia. So there's a lot of subcategories under this major umbrella term called dementia. Some of these are irreversible, and I've named a few already, like Alzheimer's and Lewy body, Parkinson's. But there are some that are reversible, like those due to depression, or drug interactions, or nutritional deficiencies. In total, there's over 120 distinct types of dementia. One thing to keep in mind with dementia, especially when we're talking about dementia that's irreversible, is it's not just about memory. And some people have drawn that conclusion that my loved one, forgot what he had for breakfast, and then my loved one forgot how to dress himself, and then my loved one forgot that I was his daughter, and then he forgot to breathe. And that's not necessarily the case. Loss of memory is one part of dementia, but it's so much more. And the more we caregivers can understand what is really going on, the better, because then we know what we're dealing with and we can respond appropriately. So for dementia of the Alzheimer's type in particular, what the implicating factor is neurofibrillary tangles and amyloid plaques that accumulate in the brain. When those plaques and tangles accumulate in the brain, they create a toxic environment which causes cell death. And so what we're talking about with dementia, and I'm talking about dementia of the Alzheimer's type right now, just for the sake of simplicity, we're talking about brain loss over time. We're talking about cells dying over time. We're also talking about the brain itself atrophying, meaning it gets smaller, and enlargement of the ventricles, which means those spaces right there get bigger. So it's actually brain loss over time, which means we caregivers can't just focus on, don't you remember this, and let's help you remember that. We have to remember they're doing the best they can with the brains they have. So here's the progression of the disease in pictures, although I got to point something out. They made a mistake with the progression here. You can see the healthy brain, and then they made a mistake and switched mild and severe. But the middle picture is the one I want you to look at as far as severe Alzheimer's disease. The brain itself has has gotten smaller. The word is atrophy. And those ventricles have gotten larger, the spaces. And so you can see with brain damage, it would be very difficult for your loved one to be able to respond, to be able to understand, to be able to interpret the world around them. So let's talk about how important this organ is, the brain, and why it's so important for us caregivers to know what's going on so that we can respond in the best way possible and always remember that they're doing the best they can with what they've got. So, as I said before, the brain is responsible for interpreting the world around us and also for expressing ourselves. In other words, our behaviors, our moods, our five senses, our perception and interpretation are all controlled by the brain. And when the parts of the brain that are responsible for those different manifestations are damaged by dementia, then our loved ones no longer have the capacity to control those things. And this is a great slide if you have a handout where you can just keep going back to it and say, all right, what part of the brain is being affected so that you can get really adept at understanding this is a brain issue. It's not stubbornness. They're not doing this on purpose. You don't need to make lists for them over and over again. This is truly them trying to do the best they can with what they've got. So I have a little clip here.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
So I wanted to comment just a little bit about that video. When I first saw it, and I'm a professional, I found it a little jarring. And the reason I found it jarring was because now we're not talking about a patient, we're talking about my dad. And so on some level, those of you who have not seen that video before may feel the same way. Now it's personal. But what I did next was to watch it again. And then I went back and watched it again, and I watched it again. And the value in doing that is to help us caregivers recognize this is a brain disease. This isn't something intentional. This isn't something that your loved one can help. It also helps us understand that there's certain things that are predictable about dementia. Now, different dementias are going to proceed in a different way. This happens to be just dementia of the Alzheimer's type. Also, it can be different for different people. So while it does manifest first in the hippocampus where memories are stored, it doesn't necessarily go in this clean, neat progression from the front of the brain to the back, right? Even if it does, the outward manifestations might be different for different people. So the value in this is to understand that there's some stages involved in this process. And again, nothing is formalized. There's no such thing as, one way to stage dementia of the Alzheimer's type. But there is a way to conceptualize it, and that's what I want to introduce today. So as a disclaimer, if somebody says your loved one is in a moderate stage of dementia, you would want to ask, what do you mean by that if a doctor says that? Just so that you're not assuming that this is a rubric that we should all adopt. So let's talk about these stages. We're going to go through all of these stages one by one. The important takeaway here is that stage 1 through 3 is not necessarily considered dementia. So we'll go through these. Stage 1, absence of cognitive decline. So this is preclinical. This is before you even see anything outwardly. Then stage 2 is age-associated memory impairment. And this is pretty normal. So we're still not talking about dementia. We're talking about memory impairment, but not necessarily dementia. It may progress to dementia in some people, but not everybody. Stage 3 is mild cognitive impairment, and we're going to talk more about that. But for now, just know 1 through 3 is not necessarily dementia. It could lead to dementia. It could be the beginnings of dementia, but it's not necessarily part of the dementia process. Now, once you get to stage 4, mild dementia, now we're talking about dementia. Mild, moderate, moderately severe, and then severe, and then we're talking about end-of-life care. Okay? So essentially what these stages are saying is a person starts with preclinical dementia. A person that has dementia starts with preclinical dementia, then mild cognitive impairment, and then the rest of the stages that are called dementia. Preclinical means the amyloid plaques, we're talking Alzheimer's now, the amyloid plaques and tangles in the brain may be present, but there's no outward behavioral, social, or occupational problems yet. Okay. Mild cognitive impairment is there might be signs and symptoms of memory loss, but the person is still able to engage in social activities like making doctor appointments, paying bills, balancing a checkbook, etc. And like I said before, mild cognitive impairment is an entity unto itself. It may never progress to dementia. It doesn't necessarily mean the person has dementia. Then from stage 4 to 7, we've got it broken down into mild, moderate, and severe, as I said. And this is where you're going to see things like incontinence toward the latter stages, the late stages, swallowing difficulties, incontinence, and loss of long-term memory. So let's go through these one by one. Well, first, we're going to do this. The duration of each stage is somewhat predictable. So if mild cognitive impairment is part of dementia, it could last an average of 7 years. Let me see. Yeah. It could last an average of 7 years. Mild Alzheimer's lasts an average of 2 years. Moderate Alzheimer's type of dementia lasts about 2 years. And then severe Alzheimer's lasts about 3 years, give or take. So you may have heard that the dementia process tends to last about 8 to 10 years from the point of diagnosis. And keep in mind that a lot of people are diagnosed at sometimes even in the moderate to severe stages of Alzheimer's. So it's typically when the outward manifestations are hard to ignore, where before it might be a little memory loss that you're seeing on the outside and you're not aware that, you know, something's going on the inside. So let's talk about what to expect at each stage and what you can do as caregivers, which is very important. The first stage is the period of no cognitive decline, otherwise known as preclinical dementia. And guess what? That's you and me, because none of us know if we have amyloid plaques and neurofibrillary tangles, right? The accumulation of plaques and tangles begins about 10 to 20 years before you ever see outward signs begin to show. Now, it's been said that 60% of factors contributing to Alzheimer's are genetic or fixed. There's nothing you can do about that part. 60% is it's genetic, meaning it's fixed. But the other 40% of causes can be prevented through lifestyle changes. Like if you have diabetes, manage the diabetes. If you're smoking, quit smoking. If you have high cholesterol, manage the high cholesterol. If you're drinking excessively, stop drinking, or at least cut back. And then also avoiding medications that impair memory, like the long-term use of benzodiazepines like Xanax, or the long-term use of hypnotics, sleep agents, even things like chronic use of antihistamines. You need to be very, very careful because they could contribute to the dementia process. So, and you can even see some of these unchangeable factors and modifiable risks that I've listed here. One unchangeable risk factor is Down syndrome. You know, that's not something the person can control or modify, it just is. Even depression can predispose to some extent if it's not managed. What are the caregiving tips at stage 1? Well, because I said it's you and me, the best thing you can possibly do is take care of yourself. So you can't change your genetics, but you can definitely manage your diabetes if you have diabetes, or your hypertension, or cholesterol. You can avoid smoking or excessive alcohol use or prolonged use of certain medications. You can make sure to eat nutritious meals and get plenty of exercise, get plenty of sleep, and you can prevent obesity. You can prevent what's called traumatic brain injury, meaning be careful not to hit your head repeatedly or involve yourself in activities that will cause your head to be repeatedly hit. And then, of course, early education seems to be a factor as prevention, which is surprising, isn't it? Stage 2, this is age-associated memory impairment. This is forgetting where you placed an object or forgetting names that were once familiar. Does that sound familiar? So it's, I want to assure you of something. Stage 2 may never progress to dementia. So if you're beating yourself up because you can't remember that guy's name that you went to high school with 30 years ago, don't worry. I mean, frankly, a lot of us will walk into a room and say, I forget what I even walked in here for. The difference is we can walk out, try to walk back in, and then we remember why we're in the room. Where somebody with dementia cannot remember, no matter how many times they're trying to do this a different way. So what kind of things can we do for age-associated memory impairment? Just the regular, make lists, set timers, and once again, take care of yourself. Go back to the list that I gave you before and take care of your health and your both psychologically and physically. Stage 3 is mild cognitive impairment. And again, this is about a bit of memory loss, but it doesn't necessarily impact social and occupational functioning. So the same thing applies. Take care of yourself. Because again, this may never progress to dementia. It may simply be its own entity, mild cognitive impairment. But you've got some control over the process by taking care of yourself and making those memory lists. Stage 4, this is when we start talking about dementia. We're no longer talking about just short-term memory loss or age-appropriate memory loss. We're talking about now losing occupational and social skills as well. So you're having difficulty completing tasks that were once familiar to you, or your loved one is exhibiting changes in their personality and they're having difficulty finding the right words to say, or they'll say a word and it's not what they mean, and then they get frustrated because you're not comprehending what they're trying to say. Or you say multiple things, give them multiple tasks in a row, and they just remember the last word you said. They're not retaining the first and the second and the third thing you said. You might see that they have difficulty organizing the way they used to, or they get lost, or they're misplacing things. They're putting the toothpaste in their bedroom drawer, and they're, hiding things, it would seem, to those of us on the outside, when truly what they're doing is just putting them in what feels like a very logical place. This is mild dementia. And you can see with this picture on the right, the changes that are happening in the brain. The cortex is shriveling up. Actually, I should compare it. So the left-hand side, you see that this is a healthy brain, right? The one on the right side of this image is the one that's diseased. And you can see that cortex, the cerebral cortex, is shriveling up, and the areas that are responsible for thinking, planning, and remembering are getting damaged. And those ventricles, those spaces, are getting bigger and bigger. And then that hippocampus, where memories are stored, is getting smaller and smaller. So that helps you see with your own eyes what is going on in that brain. So what do you do as a caregiver? Well, this is a tricky one because your loved one still has what they call insight into what's going on. They still have it. They know what's going on, and they can feel slighted by your assistance or your feedback, and it can feel a bit like criticism. It can feel like you're taking over, or you're being bossy. And so there's a lot of finesse that's involved in stage 4. But at this stage, the best thing you can do is just assess whether they need direct assistance or not, and be respectful as much as possible and allow them to do as much as possible. So it's that balance between interdependence, like joining with them in a task, versus independence, letting them do it by themselves. You definitely want to ensure safety, like determining whether or not your loved one is safe enough to drive, not only for themselves, but for the people around them. Because they may say, I'm fine, but you may notice little things that make you draw the conclusion that no, they're not fine, and the people around them aren't fine either. And so you want to ensure safety. You want to avoid unnecessary stress. So besides maximizing independence by helping to create cues and reminders, you, as I said before, you may want to share in some of those tasks so that they're not feeling overwhelmed and frustrated and stressed by the process. So for example, what I mean by that is if your loved one was responsible for paying all the bills and they're just not doing it, you can very respectfully and tactfully suggest that you would love that opportunity to pay the bills. And, just to take that stress off of them. And then, of course, take care of yourself. Start building a support system now, because this is truly, as you're going to see very soon, not a one-man show. This is really going to require a team to walk this journey with you and your loved one. The ways to maximize independence in your loved one at this stage is cues and reminders, and that might just be lists that you post on the refrigerator or calendars or big clocks, alarms, things that really help, with the routine. And then, of course, money management. There may be a better way of distributing that task so that they're not overwhelmed with things like bills, as I mentioned before, transportation, as we talked about before, and then keeping appointments. This gets challenged when your organizational and executive abilities become compromised because the frontal lobe of your brain is compromised. You may have difficulty even making appointments, as well as filling out the paperwork necessary for those appointments. Stage 5. During this stage, moderate dementia, you're going to see your loved one demonstrate compromised judgment. They may say or do things that aren't typical of them, or they're not appropriate for this setting. And you'll see some deeper confusion. You may even see them withdraw from the environment. So in addition to having short-term memory loss, they're not going to have longer-term, let me say that differently. Although the short-term memory loss is going to be pronounced, you may see that longer-term memories are being forgotten. So prior to this stage, they may be able to tell you all about something that happened years ago, and you start doubting yourself and thinking, well, maybe they don't have dementia. But it's only because the short-term memories go first. The longer-term memories are retained. And then as you get into the moderate and then moderately severe stages of dementia, you're going to start seeing that they're forgetting personal history, or the word is confabulation. They start confabulating, meaning they're filling in the blanks with a story that makes it feel cohesive to them, but in reality, it didn't happen. So for example, my father would say that he worked as a field hand in Pennsylvania, but he didn't. But that was his way of trying to explain why he had an abscess on his back. He said somebody with a pitchfork had whacked him in the back. So in his own mind, it was wonderfully logical, but it didn't happen. He was filling in the blanks, and that's confabulation. This is the stage where you're going to need help, or your loved one's going to need help with daily activities. You will too. You want to distribute your activities so that it's not all on you, but your loved one is definitely going to need some help with daily activities, and that might be just making breakfast. You might over time start seeing that it's a little more difficult to button things, zip up pants, that sort of thing. And then you may start seeing changes in the behavior or personality. And I mean significantly so. It's not, wow, they're a little bit off, or they're a little confused. This is where you're seeing some significant changes. And we'll talk about that when we get to stage 6. We'll talk more about that. Stage 5, what are the caregiving tasks? Well, you're going to adopt a daily routine, and it's going to be a simple routine. Structures are very, very important, and it's amazing how the brain hugs those routines and that structure. Even as, brain cells are being lost, the brain needs that routine and really relies on it. And the routine can persist despite the disease. So you want to do things like Every day we get up, brush your teeth, go out, have breakfast together, take the vitamins, do this, go for a walk. You know, it's the same thing every single day. And that really helps because the deviation from routine can cause your loved one a lot of anxiety. And sticking to a routine can help you so that things just go like clockwork instead of feeling like everything's a fight. With your communication, you want to speak slowly. You want to use shorter sentences and repeat those sentences and use a gentle and calm voice. So what do I mean by shorter sentences? I mean, sometimes you realize you only can say 2 words because that's what they're able to retain. And you repeat it so that they have a chance to process what you said. You don't necessarily say it in a different way. That can be confusing. But if you're going to say, we're going now, you just wait. And if you see that they're not processing those words, you say it again. Okay, we're going now. Or, okay, we're putting socks on. Socks on? Okay, socks on. You know, you're just recognizing this brain is taking a little while to grasp what you're saying. Because keep in mind, expressive language and receptive language are affected by the disease process. That is controlled by parts of the brain, expressive language and receptive language. So receptive language means they're trying to process and interpret what you're saying. Actually, because the thinking part of the brain is the part that's getting damaged, right? But the emotional part of the brain seems to persist over time. That's the part that will rely on you and your emotions to dictate what their emotions will be. So if you get frustrated, they're going to pick up on that frustration and they're going to respond with stress. If you're sad, they're going to get stressed. If you're angry, they're going to get stressed. But if you're joyful and you're calm and you're gentle, they'll pick up on that too. So respond with emotions. This also means don't worry if what you use to reassure them isn't necessarily the whole truth and nothing but the truth. Don't worry about that part. You may simply need to tell them something to calm their anxiety. And if we have time, we'll get into examples of that. You want to use written reminders or pictures as cues. And I'm saying pictures because sometimes even the ability to read written words is compromised. And so pictures can serve as reminders, like, you know, bathroom. You have a picture of a bathroom so that, you know, it's very clear it's time to go to the bathroom. It's a reminder. You can go to the bathroom and here's the toilet. You want to provide assistance with daily tasks, but you also want to encourage them to do as much as possible because that independence actually helps with maintaining skills, maintaining those neural pathways in the brain. So the longer they're able to button their shirt, even if it's a struggle, the better. The longer they are able to use a spoon and lift it to their mouth, even if it's getting slower and slower, the better. And by the way, even if they can't button, there's some really great places on the internet where you can find shirts that look exactly like your loved ones, dresses that look like what they used to wear, but it's Velcro. And so you're still helping them maintain their independence without the frustration of zippers and buttons. Driving. Try to enlist your loved one in the decision to stop driving because at this point, stage 5, the ability to even see things in the periphery is compromised. Your visual field becomes more and more narrow, so you can't see what's going on when you're looking straight ahead. You can't see what's going on the right or the left. So motorcyclists could come up alongside the car and they wouldn't see it. Or they're making a turn around a corner and they'll hit something they didn't see. So this is really important. And then stage 5 is when you see a lot of restlessness, and that restlessness can look like wandering, leaving the house, and then you're panicking as a caregiver. So you want to prevent that by thinking cleverly about how to make sure that front door is not easily accessible. And you may even have to think about raising the lock, putting a lock um, high on top of the doorway so that your loved one is not able to easily leave the house. That brings us to stage 6, moderately severe dementia. At this point, you may see more obsessive compulsive types of behavior or even time distortion. What I mean by time distortion is they're thinking they're in an earlier period of their lives. So they may be asking for their children and you're there as their child, but what they're really asking for is you as a 5-year-old or you as a baby, and they're getting distressed because they can't find the baby. And you trying to speak to them rationally by saying, I'm right here, isn't reassuring because their time is distorted. Or they may say to you, we just did that yesterday, or I watched the elections, and no amount of you telling them it's not November, that was 4 years ago, it just raises their anxiety. Just realize it's time distortion. They may not recognize loved ones. The ability to recognize faces becomes compromised because there's a part of your brain that is actually responsible for recognizing faces. And when that's compromised, it's hard for them to even recognize you or themselves. So they may have trouble recognizing themselves in a mirror. They may not be able to see two-dimensional images, and so you may try to show them photographs and they lose interest. It's because their brains aren't able to conceptualize what it is that you're showing them. And then this is the most stressful part of all for caregivers. You may start seeing neuropsychiatric symptoms at this stage, like anxiety, aggression, agitation, hallucinations, delusions, paranoia. So what can we do? Well, a long time ago I mentioned get yourself a team. So at this point, you're going to really need your team. Seek help, get some respite, like take a break, take advantage of some support groups to get some really good ideas, and get informed. And the more information you have, the more it's going to help your anxiety because you'll have more certainty. Stage 7 is severe dementia. This is loss of receptive and expressive language. If it hasn't happened already, you're going to start seeing things like loss of balance and coordination because the cerebellum, which is located toward the back of the brain, is now being compromised. So you might see them trip or fall, and that is because that part of the brain is now affected. Again, you're going to see that time shifting to this earlier period of life, and that inability to recognize their self or loved ones. Self meaning if you show them their face in a mirror, they might see it as somebody else or a nice guy. And then receptive language, if it hasn't happened so far, it would happen here. Difficulty swallowing, weight loss, and incontinence. What do you do at this stage? You're going to be relying on a lot of things that transcend words, like playing music, touch. Make sure you're monitoring bowel movements and using fiber-rich foods because the ability to regulate bowel movements is compromised. The process of pushing food through your digestive system is brain-based, and so that's compromised. If they're bedridden, you want to make sure they change their position, but even if they're still in a chair, you want to make sure they're not just sitting still for hours and hours, because they're not going to necessarily be able to tell you that they're getting sore or that they've developed a sore. And then with eating, you want to make sure they're eating upright and that they stay upright for 30 minutes. And that's because of the challenges with chewing and swallowing. End of life care, you might see that your loved one is spending more and more time sleeping, and that's very normal. And you may see that the skin is breaking down and they're more susceptible to infections, not just UTIs like a urinary tract infection, but also other infections. And aspiration pneumonia is very typical because of the challenges with chewing and swallowing, which is brain-based. And so you may see that your loved one is more and more at risk of inhaling food into their lungs. Contracture of the limbs is pretty typical because the arms and legs are, the muscles are getting more rigid, and you're going to see the rigidity in their faces as well. That the ability to smile is compromised, and it doesn't mean they're in a bad mood. It just means your brain has lost the ability to make the face smile. What do you do in this stage as a caregiver? You pay attention to nonverbal signs of pain and discomfort. You protect their bodies from wounds as much as you can, and don't kick yourself if, wounds happen, because it's just part of this process. Rely on your music, talk to them, hold hands, hug. Remember that even though it may not feel like they recognize that you're there, the essence of who they are is still in there. And that is it. So we have some time for questions if anybody is thinking about some things, or if this has brought to mind some things that you're going through right now.
I don't see any questions. Let's give it a couple minutes.
Okay, well, we can chat while questions are being generated. Maybe Dominique, you have some thoughts, or you wanted me to review something that I didn't necessarily explain extensively.
We have one question.
All right.
Okay, it's does vascular dementia follow similar stages?
Not necessarily, because vascular dementia, what we're talking about is either there's a deprivation of oxygen to a certain portion of the brain, and that deprivation of oxygen can happen as a result of a blood clot, for example. But it could just affect that portion. Now, there is such a thing as a vascular dementia where it's little micro strokes, and the lights are going out mildly so in various areas of the brain, as opposed to a major stroke where you're just going to see the part of the brain that's impacted by the stroke. You see behavioral or language manifestations on the outside. So it doesn't necessarily go in that order. But you raise a really good point. Let me tell you something. It is not necessarily so that dementias are isolated. Sometimes some people will have two types of dementia. They'll have dementia of the Alzheimer's type, and then dementia that's caused by vascular disease. And so what you start seeing is, lights going out abruptly, because that's what happens with vascular dementia. You just suddenly see a shift. And then on top of that, they've got dementia of the Alzheimer's type. And unfortunately, while you can actually see that a person has probably a vascular type dementia, you can see it on an MRI. With Alzheimer's, other than just a distinct pattern of atrophy, you can't know for sure unless you did an autopsy, and obviously you can't do an autopsy until later. So I hope that answers your question. It's not necessarily the same pattern, but if it's overlapping Alzheimer's type of dementia, you're going to see something very similar.
Okay, we have a couple more questions. This
Great,
one,
we've got time.
yeah, this one's, I don't know if it's a question, more like a statement, but it says, need to be reminded this is normal and to not get sad or angry.
Yeah, expand on that. Need to be reminded.
Yeah, I think that's
Can you
more
expand on that?
statement. We can go to the next question, which
Okay.
is there a recommended way of responding when they ask for relatives that have passed?
Yes. So this is a great example of be careful to speak to the emotions before you jump in and speak to the facts. Keeping in mind how much of my loved one's brain can handle this, because if they don't have sufficient cognitive ability to make sense of what you say, it is going to feel like a blow. And every time they forget what you just said and ask you again, it's another blow and another blow and another blow. So depending on where your loved one is in this process, sometimes it's best to simply, how do I say this? Therapeutic fibbing is one option. And therapeutic fibbing is you find a way to reassure them that everything's okay. One other option is to distract. And so you're looking at pictures and photos of this person. Another option is that you reassure them that they're fine and that they're going to be visiting soon. Whatever you need to do to address the fear and the anxiety is the primary concern. And I know that kind of rocks us because we think, but aren't I lying? And the reality is you're reassuring because they don't, depending on where your loved one is in this process, they don't have the cognitive ability to make sense of what you're saying. And it's going to be traumatic if they can't handle it cognitively. So just be, sensitive, use your intuition, and if you feel like intuitively, I gotta just tell them something that's going to be reassuring and distract them, focus on them on something that, acknowledges what they're thinking about, talk about those things, that's the best way to go.
Okay, the next question we have is, at what stage does shadowing behavior begin?
Oh, where they're following you?
I believe so.
That's interesting. I've noticed it in moderate to moderately severe. And it's, to me, what it suggests is that this person is needing reassurance of what exactly they're doing. So they cling to you because you're the leader. You seem to know where you're going. Now, as the disease progresses, it's interesting that shadowing is more pronounced. Like you can start walking and they'll get up and walk after you. And it's typically one caregiver that they seem to really be aligned with. And that person can leave the house to try to go get groceries while the staff is inside, and this loved one will follow you. I think that's what you're referring to, and it's typically in the moderate to moderately severe stages.
Okay, our next question is, how would dementia caused by Parkinson's differ from Alzheimer's as discussed here?
It truly, it's going to be what you're going to see on the outside. Well, two things. One is what contributes to the disease. So for Alzheimer's, we've got amyloid plaques and neurofibrillary tangles. And obviously with Parkinson's, it's not going to be that. But the other factor to keep in mind is the outward manifestations, where dementia of the Alzheimer's type, you typically first see short-term memory loss, and then it progresses to motor loss, meaning the person's ability to, maintain their balance and walk and use their hands. That is that's the first thing you notice is the short. Let me say this again: the short-term memory loss is what you tend to see first, and then you start seeing the motor loss second, and that would be balance, motor, coordination, etc. Where with Parkinson's, you tend to see the motor loss first, and then you see more of the dementia. The other factor with Parkinson's is there's a neurochemical involved, dopamine, and So where with Alzheimer's, you're not going to necessarily see that neurochemical effect. In fact, it's acetylcholine that's more likely implicated. Acetylcholine being a neurochemical that's implicated in this disease. But so to fully answer your question, for Parkinson's, you may see essentially you're seeing nerve cell damage as a result of dopamine levels dropping, and so that's the biggest difference. Yeah.
Okay, and then we have, is there any good YouTube channels or audiobooks of people and their experience with their loved ones?
Like firsthand experience?
Yes.
Oh, that's a great question. And isn't it true that that's where we find the most reassurance, to feel like we're not alone and this person went through it too, and came up with some great ideas. And there certainly are. That's the luxury of the internet. I also want to encourage you that if you have any questions like that, like are there any books, are there any referrals, do we have anything that we can share with you? Please feel free to call our helpline. I think if I were to answer that question, I'd take you on a tangent all over the internet, but you see our helpline number here. You can certainly call us, and Dominique, you probably have a way that they can contact you if they have any desire to find like-minded others, whether in book form, YouTube, or even in a support group, right?
Right. Yes.
Yeah.
We have a couple more. Um, it says, is it common-ish for one to not experience significant personality changes? Both of my parents have Alzheimer's. Father is farther along than mother, so I'm just wondering if there's going to be is there going to come a point where we may need to separate them if he's becoming aggressive?
Mm. You know, I my experience has been that there's seasons, and how that season manifests in terms of personality changes is different for everybody. And the things that set your loved one off can be avoided. So, no, it's not necessarily true that you're going to have to separate them. It's just that there are certain things that maybe cause frustration that can be minimized. Um, Now, does everybody experience personality changes? And I think what you mean by that are the neuropsychiatric symptoms like hallucinations, delusions, aggression, agitation. To some extent, yes, you might see just a restlessness, in your loved one. They want to go, or they're trying to keep their hands busy. But you're not going to necessarily see pushing or fighting unless you're doing something and they don't quite understand what you're doing and it's making them upset. And some of the auditory and visual hallucinations are not scary. My father's auditory hallucination was actually a Russian Orthodox male choir that was singing in the next room. And that's not bad. We all kind of wished we could hear it too. And he, the worst thing is he would just wash dishes and run that hot water for a long time as he was listening to these guys singing. But other than a higher water bill, it was, he was happy. So and when there is some aggression and agitation, there's a lot of things we as caregivers can do to minimize that. In fact, we have a whole presentation we've done on music and how instrumental that is in making sure that you're maintaining a sense of calm and peace in your household so that you can avoid things like that. So there's things you can do. I would say don't worry. Don't worry.
Okay, we only have, let's see, four more. And the next one is, which stage is this? When parents can't exactly make it to the bathroom, so not fully incontinent, but maybe on his way.
Yeah, that I would say is between moderate and severe. So I'm going to call that moderately severe. And as I say this, As I said before, this isn't standardized. This is just a way for us to conceptualize this in our heads. And as you said very well, it helps us recognize incontinence is on its way. So really, these stages are simply to help us as caregivers conceptualize this and contain it so that we can make sense of it and know and prepare ourselves for what to do next. So moderately severe.
The last couple questions are just asking, what was the name of the video you showed, because we did not get any sound for it.
Oh no. Okay. All right. So it is called What is Alzheimer's? And let me see if I can, you know what? I can switch my screen because I'm not sharing a screen, am I? So
Oh, you still are sharing screen.
you are? Oh, goody. Okay, so it's you can see it right there. Understand Alzheimer's in 3 minutes. And it's www.youtube.com. Oh, well, you know what? Just Google Understand Alzheimer in 3 minutes. You'll recognize this. And I'm very sorry about the sound. I just learned after the fact that sound doesn't do very well on webinars.
Yeah.
So I apologize for that. Too bad.
And then last couple questions, it says, do you have any recommendations for websites where you can find dementia-friendly puzzles and games?
Yes, but then if I told you about them, I would be endorsing a product. But can I just reassure you, if you can imagine it, it's there. It's there. I know this from personal and professional experience that I would say to myself, you know what my dad needs right now is he's not quite incontinent, so he would be deeply offended if I handed him something that looked like diapers, but he is not making it to the bathroom. So wouldn't that be great if I could find like reinforced underwear that looks exactly like his underwear? And sure enough, I found it. So, but again, what I'm going to do is point you to our helpline and Dominique for specifics. I just want to avoid, you know, endorsing a product and inadvertently. But there's a lot out there. It's actually really nice.
Okay, and then this is the last and final question. It's the same as the one we said before about reinforcement. They're just looking for a way to reinforce themselves that is normal, and so they don't get sad or angry.
Oh, very good. You know, so the first thing to keep in mind is it's those initial stages where your loved one recognizes that they're losing their memory. That's the most painful time for you as a caregiver because they see it and you see it. However, later in the process, you can just remind yourself that your loved one doesn't recognize that they've got a memory problem, and so they're actually okay. They're not suffering, you are. And that actually helps because if you're recognizing they're not suffering, then you don't feel so overwhelmed and sad. The second thing is just recognizing that you can find a lot of joy in any given day, and you can create that joy. And that will help elevate the whole journey so that you're not feeling as sad. And as you said before, this is very normal. This is normal as in typical. This is the progression of the disease. And in some ways, it's a bit of a luxury because you have some time with your loved one. You can anticipate what's going to happen next, and you have that time to deeply, deeply love them in a way that you didn't even know possible before this disease occurred. So I hope that gives some ideas, but listen, if there's anything else that you're needing, just please contact Dominique, contact Alzheimer's Orange County. We're here to help you.
Well, that is all the questions we have. Thank you, Dr. Galindo, for your presentation.
You're welcome. You're welcome. It was a joy to spend this evening with all of you. Thanks for being here.